Hello, welcome to Connected Rheumatology. I'm Dr. Elizabeth Ortiz. If you're new here, I am a board-certified internist and rheumatologist based out of Dallas, Texas. My mission with this channel is to provide some education on all things rheumatology, immunology, diet and movement, mental health, and wellness, because I believe it's all connected. If that sounds like it's your jam, make sure you subscribe, hit the like button for this video, and get ready for some great content. So today I'm going to be talking about something that is near and dear to my heart, and that is physical therapy. I believe that physical therapists and physical therapy in general are the unsung heroes of musculoskeletal pain and disorders. I think in a lot of cases, having a good PT on speed dial is probably more important than having your rheumatologist or orthopedist. If you're paying attention when you see your PT, you can learn so much about your own body, your movement, and why you might be having some pain and dysfunction. So today I'm going to talk about the top 5 things I learned from going to PT. All right, so let me just start out by saying what I do and what I don't do. There's a very common misconception. As a rheumatologist, yes, I am a doctor of joints. I deal with joint pain, joint inflammation, joint dysfunction. I'm not a surgeon, so I'm not an orthopedist. I have a basic understanding of when someone needs to go see an orthopedist and what kind of procedures they will likely talk to you about. But what I don't know and what I haven't been trained in is function and movement. And it can sound kind of crazy. I oftentimes would get into arguments with people at the gym who would be like, how do you not know this? You are a rheumatologist. And I was like, I know, but I can tell you, what your labs mean. I can tell you, the very, very basics. But I just wasn't trained in the nuances of joint function and how movement impacts really everything. And that's really where a good physical therapist can come in and work their magic. So this explains why when I got knee pain about a year and a half ago, all my colleagues suggested I get an MRI. And it made sense. My knee was getting swollen, it would get big, it would go down. I couldn't do any of the activities I used to do for stress release or for exercise, and I was getting really frustrated. I also might have been complaining a lot, and so they probably were recommending the MRI just to get me to shut up. But I didn't want the MRI, and instead I went to PT, and thank goodness I did. I learned so much about my gait, about my posture, and about things I can do to keep from getting knee pain again. And that experience not only helped me solve my knee pain issue, but I definitely think helped me serve my patients better, because I could actually speak to what happens when you go to see a physical therapist and how it can help and what you need to do to make sure it helps. So let's get into it. Number 1, what I learned from going to PT: joint pain is more than just about the joint. Now, to be fair, I knew this kind of from my job also, but knowing it intellectually and actually experiencing it are two very different things. When we think of joint pain, we really get focused on the bones. We think of an x-ray, and with that x-ray, all you see are the bones. But the joint is a complex structure of ligaments and tendons and bursa and menisci in the knee and fluid, and there's so many different aspects of that structure that can cause pain and dysfunction. When you get so focused on the bones and whether or not you have arthritis and whether or not you have bone-on-bone arthritis, I think we're missing the point. The entire structure needs to be evaluated and needs to be cared for, and you'll do that with physical therapy. Number 2, the joint that hurts might not actually be the joint or the part of the body that's got the problem. This actually will blow your mind when you actually experience it, and it's sometimes really difficult to explain to someone because we all are so sure where we feel the pain. But once you go and see a physical therapist and they do a full evaluation of your day-to-day life, how you sit, how you sleep, how much you're in the car, you might actually find that your ankle pain is actually from a problem in your foot, or that your knee pain might actually be coming from a problem in your hip or your low back. You know, we actually learned this when we were in grade school. For anyone who learned that old song, dem bones, dem bones, dem bones.
Toe bone's connected to the foot bone's connected to the ankle bone's connected to the leg bone.
It's not really more complicated than that. The foot is actually connected to the ankle, and the ankle is connected to the knee. So a dysfunction in one part can cause you to have pain in another. And this is exactly what I experienced. My knee was getting swollen. My knee was what hurt. I would hobble into work, but yet when I went to go see the physical therapist, lo and behold, it was my hip that had the problem. And once we found that out and really started focusing our attention on the hip, the knee pain became a non-issue. And that leads to number 3, which was figuring out the root cause of your joint pain takes time. This part is frustrating, and it's quite honestly the same when you go to see a doctor for any kind of chronic problem. It takes time to figure these things out. Now, physical therapists do have some modalities that are meant to help with the pain in the moment. So massage and ultrasound and taping are meant to help with your pain in that moment. But in order to really find out why you developed that pain and what you can do to prevent it from coming back, it takes time. Now, in my case, I was pretty motivated to get better. I made my appointments, I did my exercises at home, and I was getting frustrated that it wasn't getting better. And on my 4th appointment, I was telling him what I was feeling, I was showing him the exercises and how I had been doing them, and I was expressing that I was frustrated. And he had me on the table and started doing some manipulations, and then he was moving my hip around, and it was like, ugh, right there. That was it. We found it. As soon as we found it, it became crystal clear, and when you compared it to the other side, you could clearly see that this one movement in my hip was way off and was contributing to my knee pain. And it was just one of these things that I had been compensating for a while, but after 2 half marathons and lifting in the gym, I just couldn't compensate anymore, and my knee was taking the brunt of it. It took 4 appointments to get to that point, and it was a real eye-opener for me that you need to stick with it, and that it's not going to be a quick fix. Shocker. Number 4, physical therapy is not meant to be a massage or a spa treatment. It's work. Now, when you first go to see a physical therapist, presumably you're going to be in pain, and they're not going to push you beyond what you can do, and it can sometimes feel really relaxing. They have you on the table, they'll do some massage, they're going to do some light movement, and that's because you're in pain and they're not going to push it. But once that pain starts to get better, that's when the work starts, and that's when you really have an opportunity to get curious and ask questions. How does this movement make you feel? Where are you feeling it? When you're working with the therapist, you know, that time, similar to working with a doctor, is limited. They will oftentimes use your appointment to figure out where you are now in your journey, and then they're going to give you homework that you take home with you to do, to then work through to the next level. So you can see how this process only works if you do the homework. So it's work. It's not like, oh, I've got my physical therapy appointment and I'm just gonna lie on the table while they massage my leg or my back and then I'm done. No, you're there to learn and you're there to work. And then ultimately, number 5, physical therapy doesn't stop just because you stop having appointments. Depending on the issue, oftentimes what happens is we see our physical therapist pretty frequently in the beginning, and as we get better, our appointments start to spread out. But that doesn't mean that our exercise or our stretching or our work stops. It just means that we have to keep it up on our own without having those appointments. That is the way you are going to prevent getting another injury or having the same thing happen to you. I see it all the time. I have patients come in pretty much once a year with the same complaint. And every year I give them that prescription for physical therapy, and then a year goes by and they come back with the same thing. They went to physical therapy and they felt better while they did it, and then sure enough it came back. So they're sure that there must be something else going on with them. And you know, these are conversations where we really need to be honest with ourselves. Like, well, what did you do when physical therapy was over? Did you at all incorporate what you learned into your daily life? Do you have a new warm-up or a new cool down that you do? Have you changed the exercises that you do? Oftentimes the answer is no. And you know, that's where we run into this cycle. You know, studies that show that with joint pain, physical therapy can be just as effective at decreasing pain as ibuprofen. But that effect tends to wear off after a few months. So it might lead one to think, oh, well, it doesn't really have long-term effects, so I'm just gonna go ahead and stick with the medicine, or I'm gonna go have surgery. And that, in my opinion, is the wrong way of looking at the data. The data shows that of course it wears off if you stop doing the exercises or the stretches or the work. You can't go and do something for 6 weeks and then go right back to the behavior that caused you to have that problem and expect the problem not to come back. It just doesn't work that way. If you continue the work, you will continue to stay healthy, to stay strong, to feel secure and stable in your own body. These issues take time. Yes, physical therapy have some pretty cool tools that they can use to help you with your pain in that moment. But in my opinion, more than anything, a physical therapist is an educator. They're there to help teach you about your own body, about your own movement, and about what you can do to keep you as strong, as healthy, and as pain-free as possible. But a good teacher is only as effective as their students will let them be. So that's it for today. I hope you found some pearls in this video, some information and some inspiration that you can then take with you and maybe do your own research or ask your doctor or your own physical therapist about it. Unfortunately, in today's world, physical therapy and physical therapy benefits are really dictated by the insurance companies, and oftentimes the physical therapy that we often need isn't fully covered by our insurance companies. If you find yourself in that case, I would really recommend looking over your budget and figuring out if you can put some money aside specifically for continuing physical therapy the same way you would with your medications. As always, if you like this video, give it a big thumbs up, make sure you subscribe, and make sure you put in the comments any of your own physical therapy stories. I'd love to hear them. Or any other questions or comments you have for me if I need to clarify on something. I love hearing it. Make sure you check out what we're doing on Instagram and Facebook. Go to connectedrheumatology.com and sign up for our newsletter. Just like with this channel, that newsletter talks about all things rheumatology, immunology, diet and movement, mental health and wellness, because you know, it's all connected. Thanks, have a great day.